Hello, and thanks for listening to the My Care Champion Cast. Today's episode will outline how recently proposed changes to Medicaid could impact Michigan. Specifically, we'll learn how federal reductions could disrupt access to care for more than 1 million residents, and how you as a listener can join Michigan hospitals in asking members of Congress to protect a program that saves lives, supports thousands of jobs, and keeps vital healthcare services online. Joining me in studio, I have Laura Oppel, a returning guest who serves as our Executive Vice President of Government Relations and Public Policy at the MHA. Laura, welcome back.
Well, thank you so much for inviting me. I appreciate it.
Last time you were here, it was talking election, so I know it was a very busy lame duck season, but how have you been doing since then?
The lame duck season was invigorating. How about we put it like that?
Great word.
And, we really hit the ground running in January. The Congress does their swearing in on January 3rd. Mm-hmm. So the Christmas, New Year break ended very quickly.
Yeah.
With a trip to D.C. for that. And there's been, as everyone will know, an awful lot of activity at the federal level.
Yep.
And we're staying busy.
Absolutely. And we're here to talk about a very high priority issue. We're just coming off our Human Resources conference today where you spoke about this, but I provided a little bit of background in the intro. Can you just start this conversation explaining what exactly Medicaid is? I know that probably seems like a very baseline question, but I think it's just a good place to level set and start things off.
Absolutely. Medicaid covers about 2.5 million or more people in Michigan right now. At the height of the pandemic, we had over 3 million people using Medicaid for their insurance. It's partnership between the federal government and state government to fund that. Mm-hmm. And there's a federal match that comes for every dollar that we are eligible to spend. So right now, Michigan's federal match is roughly 65%. Mm-hmm. So if the state program were $1,000, $650 of it would be from the federal government and $350 from the state. So everybody runs their own program. No two states are going to be identical, although most states have a similar set of benefits, especially to Michigan. We don't stand out in one way or the other. We don't have narrow coverage and we don't have the most expansive coverage. We're kind of right there in the middle. We had the opportunity under the Affordable Care Act to expand Medicaid, and we took that opportunity. And I want to mention that there's a slightly different federal match for that expansion program that we have. In that case, the federal government puts in 90%. So going back to our $1,000 example, for the federal government would put up $900 for that, and the Michigan has to put up $100. And we have probably more than 1 million people also using Medicaid under the expansion population, and a lot of those are people who are single, working, but working at lower income jobs, or they might be gig workers, and they have uncertain income. Mm-hmm. So there's a great opportunity there to get a lot of people covered. And I think I heard the other day, and I don't know what the source of this was, that we are down to maybe 4% uninsured in Michigan. So we have many people covered by Medicare, which is primarily for people over 65, but not 100%. We have, as I mentioned, 25% of our population with Medicaid, and then the other half are, in commercial coverage of some sort, usually employer-sponsored.
Right, and that expansion plan, just so everyone is aware, is called the Healthy Michigan Plan. And I know you called out the specific group that sees a lot of coverage from this, but I just want to emphasize that also includes their families and children, and just people at all walks of life across Michigan are really being helped and given access to health care through Medicaid.
Yeah, the expansion allowed under the Affordable Care Act pretty much says for those people who used to have a secondary qualification. So it wasn't enough that you were very low income or even very low income, had no income. You also had to qualify as a parent or a person with severe disabilities or a person who was a caregiver for a child. And the expansion allows us to cover people who are 138% of the poverty level in terms of their income or below.
Right.
And that's been very successful during the pandemic. many people lost their employer-sponsored coverage and were able to pick up the Healthy Michigan plan. And I think it really made a huge difference for folks so that, that was a time when a lot of people became very ill.
Right.
And they had the coverage to sustain them during that challenging time.
Right. Yeah. So what's happening at the federal level as it relates to Medicaid?
Yeah. So we've known for a while that the U.S. Congress wanted to use something called reconciliation to make substantial cuts to the federal budget. And part of doing that is for the different committees of jurisdiction to decide how much they can cut out of the things that are under their control to help achieve those budget reductions. And the U.S. House of Representatives Energy and Commerce Committee determined, and this was passed as part of the overall budget reconciliation bill that the House passed a few weeks ago, that they could cut $880 billion out of the items that are under their jurisdiction in energy and commerce over the next 10 years. And I'm not going to go into the math, but it's very hard to understand how energy and commerce finds those cuts without really taking a chunk. I'm not talking about a haircut. I'm talking about a chunk out of Medicaid.
Right.
And we have been talking about that ever since to help people understand just how detrimental that is and how it's going to cause people to their health care will be terminated.
Right.
Or their health care coverage, I should say. And many folks would say, oh, no. We're not going to cut anyone off of Medicaid. Okay, maybe the eligibility will stay the same, but the funding cuts that they're looking at will make it nearly impossible to continue serving all of the populations that need the care.
Right.
Hospitals will have to cut certain service lines. They'll decide that individually. But when we cut access to care, it in some cases literally takes people's care away because they can't travel elsewhere.
Right.
Or even if they could travel elsewhere, they can't stay there to maintain their care or something like that. So it's a very critical time right now for helping people understand just how important Medicaid is to our state.
Right. And I think when we're having these conversations, it's easy to just think of the adults who are losing healthcare coverage, but Medicaid is also covering children whose health and future depend on access to those services. Is that right?
When we take coverage away from parents, they tend not to sign up their kids.
Right.
And so that 4% uninsured number that I shared with you could increase significantly, which leads to either uncompensated care for providers like hospitals and others. But most importantly, it means that people who need care aren't getting it. And for kids, it could be child visits and things as rudimentary as eye exams. It's hard to learn in the classroom if you can't see what's going on in front of you. I would also say that one of the ideas, and I don't know how popular this idea is right now, but going back to the Healthy Michigan Plan has a 90% match. What if they had that go down to the traditional 65% match? That's $1 billion hit to the Michigan General Fund. And last year, when the state finished its budget, I can promise you that there wasn't $1 billion of general fund that they decided not to spend.
Right.
The state's general fund is obligated, and finding a new $1 billion would be extremely hard for the state to do.
Absolutely. And can you talk us through the potential work requirements and why some people object to that?
Sure. So it's very easy to understand why we would expect people to work as a part of their health care. Most of us do exactly that. We have employer-sponsored care. Many, many people, in fact, I think 75% of adults are already working for those who use Medicaid as their coverage. Many other people have conditions, whether they're complex cases of diabetes or other challenging circumstances where it's really critical to help them become healthy so they can get and keep a job rather than say, well, get and keep that job first, and then we'll get you into a system of care so that you become healthier.
Right.
I think there are a lot of reasons that when you don't put the care first, that it blocks people from becoming employed. And because we know that people with chronic illness can also often be not as productive as they wish they were. They might not be as competitive for jobs.
Right.
So let's not make it harder for people to get and stay healthy. Let's get them healthy, keep them healthy, and then help them with that employment that they probably are actually seeking and not being successful at.
Absolutely. And you've touched on this from a high level, but can you just get a little bit deeper on how the proposed cuts would directly impact our hospitals and patients?
Sure. So we in Michigan make extensive use of restricted tax dollars to support Medicaid. And some of the things that the Congress are looking at, certain members of Congress believe that using restricted tax dollars are, quote, gaming the system, when in fact there are limits to what any state can do individually. We don't get more than either 65 or 90% match, depending on the population. We can't get more match than the limit that we have. I'll call it the upper payment limit in this case. So you can't go beyond what the federal government's only going to do so much. And you can't go beyond that.
Right.
And so whether we use income tax dollars or corporate tax dollars or other, restricted tax dollars that are contributed from the healthcare industry or sector is irrelevant, but they're still going after that and looking at ways that they could cut billions. And whatever they cut from Michigan in terms of our funding for Medicaid comes right out of the program. And folks might say, well, you'll still have a card in your pocket from Priority or Health Alliance Plan or Blue Cross One or whatever they call it. It says you have coverage. But an organist, a small rural hospital might say to themselves, we took such a hit in the funding, we can no longer support our labor and delivery unit. So you've got that card when you go to deliver your baby, but you're not going to go to the hospital that's 23 minutes away.
Right.
You're going to go to the hospital that's, 59 minutes away. And that is a huge difference. The other thing is when you don't have a hospital that does those services, you lose the doctors that go with it because they don't have anywhere to admit patients. So you probably don't have obstetrician gynecologists in that area. It could also threaten a pediatrics practice. So maybe somebody says, yeah, it's a long way to go to deliver a baby, but you could figure that out. You can try and make some plans in advance and be ready. And it happens once every 9 months at the most. Okay. How often do you need to go to the pediatrician?
Right.
Especially when your child is young.
Especially when you're in a rural city.
So
Yeah.
so it's folks might say we're not cutting anybody off, but cutting funding is cutting care, whether it's access to care, whether it's threatening, in some cases, not every hospital is on the financial footing that it wishes it were. And I think there are a lot of hospitals that across the country that are already in difficult financial straits, and this could be the reason that they close altogether.
Right. Absolutely. And I know on this podcast and talking about other issues like 340B, we talk a lot about how our rural hospitals are already stretching scarce resources. You've touched on it a little bit, but what are you hearing from our rural members about this? And what are, you mentioned doors closing. I think that's the biggest consequence that's,
That is absolutely the most severe consequence is losing a hospital altogether. But I don't just hear this from our small rural independent hospitals. We hear it from large urban hospitals. We hear it from systems that have hospitals peppered around the state. I hear it from my colleagues in other states. The idea of making these cuts to Medicaid is hugely difficult for them, and the contingency plans that they are thinking of are really dramatic in terms of what they would have to do to keep making ends meet. One of the things that I don't think people whether they're in a leadership role, a lawmaker, a decision maker, a policymaker, or just, someone in the general public would probably, have no way of knowing is for years, hospitals lost significant amount of money on the rates they were paid for Medicaid and even some of the add-on payments that we manage did not cover the cost of care. And over about 10 years, probably from like 2010 to 2020 or 2013 to 2023, in the aggregate, Michigan hospitals lost $13 billion on Medicaid. They served those patients, but the payments were not adequate to meet the cost of that care.
Right.
When you are losing money every year on things like that, it makes it hard to have all of the upkeep you would like. I know of one organization that has a lot of infrastructure to repair. You might not be able to hire all the people that you were trying to hire. And hospitals are doing a little better these days on Medicaid, but we have in no way made up for those losses over so long.
Right.
And it gets to the point where you cannot continue to, you've got to fix some of those things that are older in your hospital or replace equipment or whatever. So it's really dramatic for everyone, whether you're small and isolated in our state of Michigan or you're large in one of our cities. And, it makes a difference to everybody.
Absolutely. And we actually have a stat that fewer than 1 in 5 adults want to see Medicaid funding decrease. So this goes beyond hospital leaders. This is the general public knows the benefit of Medicaid. Can you explain why Medicaid is so important to Michigan's economy?
Absolutely. So Medicaid is a very significant payer, covering 25% of the population. But in some ways, it doesn't mean that 25% of each hospital's funding comes from Medicaid. It varies by hospital. But Medicaid is the single largest payer for long-term care services. Many people have either a relative or somebody who's close to them who needs Medicaid to help pay for their long-term care. And the next thing that Medicaid pays for is the largest single payer is labor and delivery services that I mentioned earlier. Medicaid is also the largest single payer for mental health services. And I don't think anyone believes that we have an excess of mental health services in this state. And we're not unlike other states. Everybody is struggling. But there are so many needs that we have for people with mental illness, especially people with complex cases or more severe illness. And we just are barely accommodating people at this point.
Right.
It's a huge payer. If Medicaid can't pay, we cannot employ the people who deliver those services. If we're not employing those people who deliver those services, that means they've lost their jobs.
Right.
And hospitals employ about, just over 215,000 people in this state. If one of the other sectors were to say, let's say there was a risk of losing 10% of our staff. If any other sector was saying, well, we're going to have to lay off 21,000 people, it would be headline news.
Right.
So I'm not saying that these cuts would result in a 10% cut. I'm just saying, think of the size, think of the magnitude of the number of people who are employed in healthcare and how many of them are threatened by substantial cuts to the funding that we use to support all of these programs.
Right. And I think you said this earlier, but it's just I want to emphasize this, that it's not just going to affect patients who are on Medicaid. It affects all patients across the board.
If a hospital has to give up its inpatient psych beds, we have some hospitals that have a significant number of inpatient psychiatric care services in really, quite rural areas. Let's say that they had to close that. They're not closing it for people that have a certain type of healthcare card. They're closing it for everybody. If the community loses its hospital that does labor and delivery, they don't say, oh, well, you can come here if you have a Blue Cross card.
Right.
It's only if you're a person. No, we're closing it for everybody. And you don't have to close the entire hospital to perhaps close a service line like one of those. Or I know of a hospital that many years ago recognized that they really needed to be able to do radiation therapy for cancer, for people with cancer in their area, even though they were very rural. And they developed that program with one of the hospitals in the nearby city. Because many areas of our state, people aren't going to drive very far in the winter,
Right.
especially if they're older, to get that type of care. And if you had to let that go, again, you're letting go of that cancer therapy for everybody, not just the people with certain types of coverage.
Absolutely. Laura, I want to thank you for being here today. I'm going to include links within the description of the episode of where people can go to learn more and get involved. But can you just share with our listeners how they can help protect Medicaid?
So at our website, mha.org, we have a Legislative Action Center, and you can go there and get a message to your member of Congress about just how detrimental these cuts would be. And don't let them convince you that they're only going after fraud and abuse. They're going after our funding. They're going after specific ways that states pull down allowable and legal federal funding. And it makes a huge difference. And cutting funding is cutting care. Maybe you're not making changes to eligibility, but when you cut funding, you're still cutting the access to care.
Right. Yeah. And we make that really easy. It's a preloaded message where essentially you just have to add your contact information and your address, and then it'll take care of the rest for you.
Right.
So it's
I would ask you that if you do use that opportunity, please edit the sample message we have so people know that it came right from you,
Right.
and that you weren't just a robot.
Right. Personalize it if you can, but the bulk of the
Personalize it if you
information
can. Yes,
is
please.
there. So absolutely. You can help. So lend your voice and contact lawmakers by using, again, our MHA Action Center at mha.org. Laura, thank you so much for being here. Anything you want to add?
I just want to say this is about people getting hurt. It's not about budget details. Let's keep our focus on that.
Perfect. Thank you so much.
Thank you.
With that, I'd like to thank our listeners for tuning in and encourage you head to mha.org to visit our Legislative Action Center or learn more. Thanks. We'll see you next month.